Klinefelter syndrome is a chromosomal disorder discovered by Dr. Harry Klinefelter. A normal male person has one X and one Y chromosome, but a person with Klinefelter inherits an additional X chromosome, or sometimes even more. The extra X chromosome causes less testosterone production. Testosterone is the hormone responsible for the development of male sex organs, as well as secondary male characteristics such as height, body shape, voice, facial, and body hair. Normally, the hypothalamus starts to produce more GnRH, which stimulates the anterior pituitary gland to secrete LH and FSH. These hormones affect the Leydig cells and the Sertoli cells. The Leydig cells are in the interstitium of the testis, and in response to the LH, it converts cholesterol to testosterone. The testosterone, along with FSH, stimulates the Sertoli cells in the seminiferous tubules of the testis to produce more sperm. Testosterone, to maintain balance or homeostasis, inhibits GnRH and LH, while Sertoli cells release inhibin that will inhibit FSH. In Klinefelter syndrome, the hormone balance is altered since the extra X chromosome of Sertoli cells and Leydig cells, making it incapable of producing inhibin and testosterone, respectively. This results to an increase in LH and FSH levels. The compromised testosterone production will then suppress testis maturation, sperm production, and the development of secondary male characteristics. In fact, this event causes an increase in the estrogen and testosterone ratio. So by now, you might be wondering, how does Klinefelter syndrome exactly occurs? Well, Klinefelter syndrome develops when a gamete, either a sperm or an egg, contains at least one extra X chromosome. Meiosis is the process by which sexually reproducing organisms generate gamete. During the third stage of meiosis I, the tetrads are pulled apart by the spindle fibers, each half becoming a dyad. This process reduces the chromosome number by half, creating 4 haploid cells, each genetically distinct from the parent cell that gave rise to them. However, in patients with Klinefelter syndrome, there is a non-disjunction of the chromosome pairs, either in female or male germ cell. This results into 2 gametes with a pair of X chromosomes and 2 gametes without X chromosomes. Alternatively, the sister chromatid of the X chromosome don't separate in meiosis II, which results into 1 gamete with a pair of X chromosome, 1 without any, and 2 normal gametes due to non-disjunction. In the end, this will result with the gamete with an extra X chromosome. Thus, after fertilization, the embryo will now have 47 chromosomes, in contrast with the normal 46 chromosomes. Symptoms of Klinefelter syndrome are most apparent around the time of puberty, because this is when growth spurt occurs, and testosterone is very much needed for the development of secondary male characteristics. They usually have hypogonadism, which means having a small penis and small to atrophied testicles, and are often considered sterile. In other words, unable to have children. Physically, they are tall with long extremities, paired with short torso and a broad hips just like a woman's. Gynecomastia also develops. It means developing a breast tissue. And since they lack testosterone, a hormone which helps in the male muscle development, people with Klinefelter syndrome are observed to have less muscle mass. With regards to cognitive development, people with Klinefelter syndrome has a mean IQ lower than normal. And since the development of the secondary male characteristic was compromised due to the low levels of testosterone, people with Klinefelter syndrome are observed to have less facial and body hair. Furthermore, they have low energy levels. There's also an increased risk of diseases that are more common among women, such as breast cancer, osteoporosis, and autoimmune diseases such as systemic lupus erythematosus. So, how do you diagnose a person with Klinefelter syndrome? Well, you use a karyotype. It visualizes each chromosome, including the X, Y, and the extra X chromosome. Karyotyping can be done before birth with an amniocentesis or any time after birth with a blood test. Blood tests can also be done after puberty and will show low levels of testosterone and high levels of LH and FSH. So how do you treat a person with Klinefelter syndrome? Treatment is focused on replacing testosterone through hormone replacement therapy, and treatment for infertility in some cases can make reproduction possible. Now, to summarize everything we have talked about, Klinefelter syndrome is a genetic abnormality where there is an additional X chromosome, mostly due to non-disjunction. A person with Klinefelter syndrome has reduced testosterone levels and elevated luteinizing hormone and follicle-stimulating hormone. Male sterility and feminized physical features is therefore observed in people with Klinefelter syndrome. Thank you and have a wonderful day.